Good evening, everyone. I'm Dr. Abbas Ali, your orthopedics faculty with Marrow, and we have Dr. Mukhmohit sir and Dr. Ranjan sir here with us to basically guide you and review your timetable or your timeline for the preparation of the NEET PG 2023. We had a similar session that we conducted 1 month ago with Dr. Rohan, Dr. Sakshi, and Dr. Rakesh, where they discussed the specific details of how to revise the final year subjects with the timeline that they had then 1 month back. Now we are gathered here today to address the new timeline that we have now, that is minus 1 month, and to have understanding of how to review the short subjects and specific subjects like second year and third year and first year subjects, and what are the fundas and hacks that we know that worked for us and might work with you for you as well. So hi, Dr. Mukhmohit sir and Ranjan sir.
Hi, very good evening,
Hello,
guys.
sir. Very good evening to all of you guys.
Right. So without wasting any more time, let's quickly get into what this session is for. First of all, the most important thing is this session is for people who are going to finish everything by December. Hopefully that you should start your revision in January. That's the main aim. The aim is to start your revisions in January at least. If you're someone who has not finished their syllabus or is still going to overflow and study in January and February, this might not work for you or probably will give you anxiety. So this is for people who are going to finish in December. We are going to discuss the updated timeline and what you need to revise, right? The things that you need to revise, because as you are studying, you must have studied from so many resources, so many places. We are going to tell you what you need to focus on for proper revision, number one. Number two, we are going to share a specific fundas and hacks of each subject from first, second, and third year, and short subjects that can help you revise. We are going to talk about the role of revision videos and MCQ discussion videos as an aid or a necessary tool for your revision. We'll also talk about the question bank and the humongous number of bookmarks that you must have right now and help you minimize that to focus on the weak areas of your preparation. We'll also talk about the grant tests and how to improve your score and review the grant tests. And last but not least, we will discuss the last lap or the final small revision that you should do before you go for the exam. So let me just show you the rough timeline that you have with you right now. This is probably end of December, and hopefully you should wrap things up and closely knot everything up by the end of December, and you should start your revisions in January. If you start your revisions in January, you will have good 2 months to revise the things. The first thing is 2 months is enough to revise. It is enough. You can revise, and the minimum number of revisions that you should have is at least two. And we have thought of this, and we have divided those two revisions into two parts. The first part, that is 45 days, the first revision, and the second part, the 15 days, the second revision. The remaining last few days that you must have left with you are the bonus days where you will do the quick, small, rapid revision before you go for the exam. The most important takeaway here is that the timeline for this revision is very rigid. You have to finish the subjects in the fixed amount of time that you have decided. Otherwise, you will be unable to revise. And please understand this, my friends, without revision, whatever you have studied, whatever you have accumulated, the information is going to get wasted. So please understand the importance of revision. Reading new things is not important. Revising, it is very, very important. So what should be the source of your revision? For the first revision, these are the few things that I would like to suggest and I wanted to keep in mind. You can do whatever you like, but these are the few things that has worked for many, many people. And so hopefully it will work for you. You should review your notes. If you have prepared your notes by watching the videos, you should review that. Or if you have purchased the printed note, ready-made notes of whatever version of Marrow you were using, doesn't matter whether it's 4 or 5 or 6, doesn't matter. Whatever you have, you should review that, because reviewing the notes will give you the maximum return of your time invested or maximum bang for your buck, because the information that you will review will be faster and more important than whatever you think or imagine. Number two, you can also use revision videos. That is an important aid for your revision that will help you revise if you don't want to read the notes, especially particularly important for short subjects. And if you don't want to watch the revision videos, you can use the revision video notes that has been shared to you on your registered email in by Marrow. You can use that. You can take a print out of it and you can revise and underline the information there. MCQ discussion videos is another aid that you can use to expedite your revision process. And last but not least, you should definitely go to the bookmark questions of the respective subjects that you're revising. So these are the things that you should cover in the first round of revision. Is this enough, sir, or am I missing something?
So I just like to add one thing, that is basically there will be many guys who would have started revision. They might be 20-30% through the revision. There would be a lot of guys would be about to finish the course by the end of December and trying to start revision in Jan and Feb. So the thing that you pointed out, I'd just like to say one thing is that many of you guys, you might have self doubt, will I be able to make it in just 2 months? You can make it, but the only thing is, as we have already said, 45 days plus 15 days for two revision. The only way you'll be able to achieve the revision in these 45 days is by making a timetable. Divide 45 days into 19 subjects, depending upon the priority. Medicine, pharma, it will not be equal number of days. And then you give yourself daily targets, and then break that 10 hours a day into hourly targets. So until and unless you give yourself hourly targets, you'll not be able to cover it up in those 2 months. So keep that in mind. And at last, that last 4 days, so your target should be to wrap up two revisions towards the end of Feb. Don't count 4 days in March. Keep those 4 days for cushioning, right? If some days are wasted, or the last 4 days are important for a quick revision of the 20th notebook or images or whatever you planned for quick revision of those. So that's all I'd like to add, sir.
Yeah. So, like Ranjan sir has told that we should be making a timetable. Along with the timetable, I personally feel that one thing is when I was studying for these entrance exams, I used to make a lot of timetables. Everybody makes these timetables. But the only thing which helps us stick to these timetables is when I made a timetable and I shared it with someone. So that sharing helps me to have that motivation level, or that fear that I shared it with my mom, dad, brother, sister, friend, girlfriend, boyfriend, anyone you share it with someone, so that they have that eye on you and you become accountable towards that whatever plan, strategy, or schedule that you had made. So one is to make that schedule, stick it on the wall or put it on the study table and share it with someone so that you are accountable, and ask them to do a check for you that I was supposed to do this in 2 days. Did I do that? Yes or no? So because leaving that whole thing, it may vary. So that was one thing. And second is, many students are saying that we have not even started revision. So that's okay. And at this time, Ranjan sir and Abbas sir both have told the same thing, that beta, at this time, you are very near to the exam. It's absolutely fine to have anxiety that my scores are not improving. I'm not able to improve. I've not started revision. What to do? It's okay. Just start your revision now. And the strategy for covering all the subjects, the short subjects, first year, we are going to discuss right away. And hopefully this session would be very useful for you.
And one more
Right.
thing I'd like to add on the revision videos. Sir, as you talked about revision videos as a source for revision. Now, how to use the revision videos? See, the one thing is, if I have two options, right? I've done the main videos, I've revised my notes pretty well, and I'm confident in those notes for all 90 subjects. Then is it necessary absolutely to go and do the revision videos? No, that would be counterproductive. If you are confident with your notes, you have seen all the main videos, then at that time use this time to revise your notes of main videos. But then what is the role of revision videos? Now let us say someone is struggling to complete the course before Jan, towards the December, 2 or 3 subjects are left. So you can go selectively for revision videos. Or if you find some subjects which you are finding difficult to revise from the notes of main videos, you can go for revision videos. So guys, use the revision videos selectively to your own benefit. That is one thing, sir, I'd like to say about the revision videos. How to use
Revision
it.
videos we can discuss again in the session. There is a
Yeah.
part for discussing MCQ discussion revision videos. This is just an
Okay.
overview in the beginning. We'll come to the revision videos and MCQ discussion videos. So this is what we think we should do in the first revision of 45 days. And I would like to re-emphasize the wonderful thing Dr. Ranjan sir and Dr. Mukhmohit sir has said. Most important thing Ranjan sir has said and you should take away from is that you have to be very rigid with your timetable. Unless you plan to finish everything in the first 45 days, you will never finish your revision. And making timetables is easy, executing them is hard. And the easiest way to execute them is that once you have a big timetable, you should have a daily timetable and an hourly timetable. And the moment the time for that 1 hour target is over, you should drop it and you should move on to the next thing. You have to be thoda ruthless. You can't hold on to things. You can't feel कि यार I have to master this and then move on to the next thing. ऐसे नहीं होने वाला है. There will never be a time where you will feel complete about anything. You will have to say, it's over, time is up, I have to do the next thing. Otherwise, you will be stuck on that one thing. And wonderful thing that Mukhmohit sir has shared is accountability partner. Somebody should be there to keep you accountable. Otherwise, what will happen is you will be sitting in the room all alone with your books, and you will go in your daydreams, and you will be imagining kya rank aayega aur fir uske baad meri shaadi hogi ki nahi hogi, and then you will be lost. Somebody should come and tell you, beta, what has happened? You've been here for 2 hours, have you finished what you plan to do? Those kind of accountability partners you need. Parents are wonderful, siblings, a boyfriend, girlfriend, or whoever can keep an honest accountability for you.
जब तक
Will
जूता
help
ना
you.
पड़े तब तक हम पढ़ते कहाँ हैं? So till the time we get full scolding, it has to go on.
Right. So that should be the first revision, which you should wrap up in the first 45 days. Now, for the next 15 days, these are the things that we suggest. You finish, if there is something that you have missed in those 45 days, try to finish it in the remaining 15 days as soon as possible. And very important thing that I would like to emphasize here is previous year questions. I think we will discuss more about the importance of previous year questions later. But remember, in those last 15 days, you have to definitely finish the previous questions. 3 years to minimum hai. Time milta hai to 5 years bhi kar lena. And also, you will have to do the bookmark questions. And again, we will discuss how to reduce the number of bookmarks when you do the question bank, and we'll discuss that also. And pearls, 20th notebook, mistake book, whatever book that you have kept on the side to revise before you sleep, or you revise before the exam, you can do it in the second revision. So this was a general timeline strategy for you to finish things in 45 days and 15 days. But more important than that is execution of the plan. And please remember what Ranjan sir and Mukhmohit sir has said. Now, with that out of the way, we will be discussing the specific fundas and hacks to revise the first year, second year, third year, and short subjects. Let's start with the first year subjects: anatomy, physiology, and biochemistry. Can you start with it, Dr. Mukhmohit sir?
Yeah, but regarding anatomy, first year, all the first year subjects, what all we have seen in the previous year trends, two things are the take home messages. One is that most of the questions, especially talking in anatomy and physiology, most of the questions have been previous year repeats. So invariably, first thing that you have to focus is upon the previous year questions. Very important, first thing. Second, talking specifically about anatomy, it has been seen that the trending questions which are coming in anatomy are mostly image-based questions. And second is regarding the muscle anatomy, where the attachment is, what is the action, especially relating to the clinical correlates. So topics like nerve muscle supply, that is one of the most asked questions in anatomy, and mostly you have to go through the revision videos, do all the previous year questions for INI-SET, NEET, FMG. Importantly, do not miss upon histology, epithelium, cartilage. Neuroanatomy has been not so much in focus, but yes, blood supply of the brain, cranial nerves, these are like questions which are very frequently asked. Plus the nerve supply and muscle supply, and that is like more clinically oriented. So anatomy is mostly, we have seen previous year questions. So focus on two things: previous year questions and revision videos for anatomy.
Right. I think that is perfectly summed up. Anything you want to add, Dr. Ranjan sir?
Well, yes, perfectly said that thing. And anatomy is a subject. Actually, there was a saying regarding anatomy when we were preparing in our times, AIPG, that no matter how much you study anatomy, new question will not be able to solve. You'll be only able to solve those questions related to the topics which have been asked in the previous years. So basically, our target was to do anatomy in and around the PYQs, previously asked questions, because as it is, it's a vast subject and it is difficult to retain. So if you're not that much confident with anatomy, you can just go through the last 5 to 6 years of PYQs and do those frequently asked topics. You can do that. And with biochemistry and all you can try to squeeze the content. I mean, there are lots of cycles and all. Try to squeeze those. Biochemistry is such a subject. You need to paste some stuff on your walls so that you can frequently revise them.
Yeah. So for biochemistry, like since we have started this topic on biochemistry, for biochemistry, 2-3 important things. Again, that same funda for all the first year subjects as previous year questions and revision videos. But more than that, in biochemistry, the trending questions have been like more on molecular biology, the recent basic molecular biology techniques like normal, like PCR, FISH, sequencing, microarrays, and so on, plus enzymes. and the enzyme defects and the metabolic defects. These are like high risk areas in biochemistry, so make sure that you revise this. Vitamins is evergreen topic in biochemistry. Vitamins, the use of every vitamin, deficiencies, these are evergreen topics in biochemistry, so make sure that you revise all the pearls in biochemistry. So this is specific for biochemistry, like PYQs, revision, and pearls, along with all the other things in revision videos.
What about physiology, sir? How should one go about quickly revising physiology?
Physiology is a huge subject. In fact, most of the physiology, which all those who are listening to the session right now, you should be able to interpret this, that most of the physiology you are already covering in medicine, in many other subjects. Not talking only of medicine, in pediatrics and gynae, everywhere you talk about physiology. But specific to the hardcore MCQs in physiology, again, funda is still the same: revision videos and PYQs. But more important stressing areas for physiology, especially for physiology, is cell organelle functions. These are like trending questions. Then all the touch receptors, these are again important. And apart from this, like muscle spindles, Golgi tendon organ functions, GI hormones, regulation of the GFR, these are all like usual topics which are done. So for physiology beta, what is important is you have to do all the topics, all the questions in and around the PYQs, the previous year asked questions. Along with PYQs, follow all the revision videos. In case you do not have time for revision videos, that's okay for physiology, because you're already covering in medicine, pediatrics, and many other subjects. You can depend upon the QBank or even the notes from revision videos. You don't need to specifically focus on the revision videos, but make sure PYQs are important.
Excellent. So, I mean, I wanted to take both of your opinions here. Can we safely say that there is a difference between NEET PG and INI set? INI set is an exam which will focus more on pre and paraclinical subjects, understanding their basics and fundamentals, whereas a NEET PG is a heavy clinical subject exam pattern where the questions usually will be clinical. Even if the question is a pre and paraclinical subject, it will be asked in a clinical fashion.
Clinical fashion, yeah.
Yeah, so actually, what happens is, if you see the INI set pre-para, they ask little bit in more depth. The depth of asking is very deep. But what has been seen in the last two NEET PG, the pre-para questions, they're little bit superficial as compared to INI set or the clinical questions which they ask. So pre-para, I mean, the level of MCQs, they are not as difficult as they are in the INI set. So people who have not done well in INI set, they need not bother with respect at least to pre-para. They will do pretty much well. I mean, they will surprise themselves in the NEET PG.
That is what Mukhmohit sir was saying. Ki if you focus on revision videos and MCQ discussion videos, aapki naiya paar hai, because that will cover most of the superficial questions, repeat questions, and previous year questions. So you're kind of covered there.
Yeah.
Now, can we proceed to the second year subjects like community medicine also? I mean, because that is one subject that I really don't understand. It will have questions from all the years: first year, second year, third year, and final year. How to deal with community medicine, sir? It's always been a problem for me when I was preparing for my exam, and I understand that you have made it very easy for the students. But quickly, can you tell us how to wrap it up?
Yeah, very fast, very quick review. I don't want to spend too much time on community medicine. It is a very raddi and boring and bekar subject. I know everybody has that feeling. So I also have the same feeling. So we all are in the same boat. But for community medicine, there are three broad branches, the three broad areas of community medicine. One is medical research, epidemiology, screening of disease, biostats. These questions out of these medical research, biostats is very less asked. Do not worry about biostats. Don't tend to waste your time. I would seriously say waste your time on studying biostats. It's not required for NEET entrance exam. It will come, but what is mean, median, mode? What is standard deviation? Simple question. So coming to epidemiology, do it from all the, you can safely do epidemiology from the QBanks. That is very nicely given. You don't even need to watch the revision videos. Any MCQ where you get stuck, like what is the difference between case control cohort, you watch the revision videos, otherwise not required. Coming over to the second branch, one was medical research, second branch is like preventive medicine, nutrition, environment, disaster medicine, all these things. These all topics, do it from QBanks, again not required to touch upon any other videos, because there's revision time. So do all the QBanks, revise them again. Coming over to the next big topic of national health programs. Beta, national health programs, they have been updated and they are there updated in your revision videos. For national health programs, I would recommend you to watch the revision videos once and do the MCQs. That's all about community medicine. Yes, previous year questions are important, but they are not very much important because every year you don't get the same set of questions. But yes, topics like leprosy, they have been asked every year, health indicators, you all know these topics. So doing the summary for community medicine, I would suggest you to focus more on QBanks, but national health programs have to be dealt in revision videos. Coming to the second point, PYQs, yes, they are important. And third is follow the pearls, and that's all about community medicine.
Sir, what about problems in community medicine? Those arithmetic problems are they still
These days, there are not so many arithmetic problems. Even if they give arithmetic problem, they'll ask you like, what is 100 divided by 10? That's the maximum they give you. इससे ऊपर वो पहला जमाना था, they used to ask about sample size calculation, confidence interval, इतना tension होता था. Now it is much easier, and in fact that is what is required at MBBS. So numericals you don't need to fire your brain on that. For INI set, yes, I would have definitely changed my version, but for NEET FMG exam, that's okay. Keep yourself cool. सब अच्छा होगा.
Awesome, that is wonderful. What about the second year subjects, sir? Pharmacology. Can I take your time here, Ranjan sir? Can you just help us with pharmacology?
So I think it's in much demand. Students are messaging about pharmacology, pharma.
Yeah, so as I've said time and again, pharma is like God. It's everywhere. Medicine, surgery, gynae. You go anywhere, you will find pharma, drugs, right? And you look into your house, also you'll find pharma. At least you'll find paracetamol. Paracetamol is the god of drugs. Everywhere there is paracetamol, isn't it?
Yeah.
So now see, what you need to do in pharmacy. See, guys, you know pharma is a subject. It's a volatile subject. It is difficult to remember. But then how to tackle pharma, how to make your life easier with pharma, I'll tell you 2 to 3 points. Number one, I have told this time and again in my lecture, write down drug of choice separately. You should have that 5 to 6 pages of drug of choice separately. Any exam, easily, you'll find 5 to 8 questions on treatment, drug of choice, right? Like recently they asked about infantile spasm, etc. And every day what you have to do is, you don't have to invest too much time. I'm just asking you, can you give just 5 minutes every day before you go to sleep? Keep that drug of choice book or pharma book under your pillow before you go to sleep, 5 minutes, overlook 5 DOC, and tomorrow just revise another 5 DOC and try to recall whatever you have revised yesterday. Now start doing this from today itself till the day of your exam, and your 50% of job is done in pharma if you remember all the DOC. So you're investing only 5 minutes every day, and you'll be done with all the drugs of choice. So that is as far as those 5 to 8 questions would be covered. Now, what else they ask is about mechanism of action or side effects or toxicity. In that case, what to remember is, what do you think an examiner is interested more in? A drug which is more commonly used or less commonly used? You understand, right, what I'm trying to say? Obviously, a drug which is more commonly used. So let me break it down for you. For example, if today you are an examiner and you want to ask an MCQ about treatment of depression, will you ask about MAO inhibitors? No, they're redundant, they're not used. So MAO inhibitor, nobody's going to ask. Will you ask about tricyclic antidepressant? Yes, you can ask, but what will you ask? They're not that commonly used in depression, but if they are used, there is a huge risk of toxicity. So you'll ask about side effect, toxicity, antidote of TCA. That's done. But if use is asked, mostly they'll ask about SSRIs or mirtazapine or the newer drugs in depression. So similarly, you got the hang of it. What I'm trying to say, in each and every topic, focus, like in case of CVS, they'll have one MCQ from amiodarone or digoxin, drugs causing QT prolongation, ACE inhibitor. In a similar fashion, I've given you a list of 20 to 25 drugs. It's in schema in Marrow as well. And someone asks in the chat box, how can I revise 19 subjects in last 4 days? You need not revise the entire content in last 4 days. You cannot. You have to revise selectively. For example, in pharma, in those last 4 days, can you revise at least the drug of choice? Can you revise at least 25 drugs list that are given to you? That is the thing you have to do in each and every subject, right? And that is one thing you have to do and focus in pharma, guys. And sir, would you like to add anything for pharma?
So personally, for me, Boli sir,
Yeah, please, sir. Please, sir. Go ahead.
So personally, for me, pharmacology was always something that I was scared of. But the kind of confidence the students have in you is reassuring. But again, to emphasize what sir said, you cannot do everything like in one go. There will be a cognitive overload, and you will just get scared and burn out. You do 5 DOCs or 5 things every day, and then you keep on revising them again and again. I think that is the safest way of completing a subject that is so volatile like pharmacology.
Yeah, that's what sir ne jo he told na that you keep the book under the pillow. I feel, I personally, like, nobody should take it in other sense. There will be two advantages of keeping the book under the pillow. Neend bhi achhi aayegi, and you will learn DOCs also. So there are two advantages. So again, pharma is a very dreaded subject, and it has to be understood in a very systematic manner. That's what Ranjan sir has told us right now.
Yeah, so one more thing I'd like to add. Actually, this is what I conduct those weekly sessions of pharmacology, and that is where I guide them to revise pharma in a different manner. I mean, you can do this for volatile subjects like pharma, micro, and biochemistry. I used to do this for these three subjects. Where what I used to do is I'll study pharma for 2 hours today. Tomorrow I will revise that stuff for around 10 to 15 minutes or 20 minutes. Day after tomorrow, I'll overlook that just for 5 minutes. So I'll read, revise, re-revise, read, revise, re-revise. And what happens is when you complete the subject at the end and when you look back, surprisingly, you tend to remember a lot of stuffs, right? And because doing that thing time and again, it sends them into your permanent memory. So that is something RRR, read, revise, re-revise. You can do it selectively for few subjects. That's one thing I want to add.
While you're on the topic of studying pharma, patho, and micro in RRR fashion, can you just tell what we can do for micro and patho, which are again one of those subjects where you have to revise and memorize quite a
Yeah.
lot?
Yeah, actually, microbiology and pathology. So I see what you have to do in microbiology. If you look at the trend in our times, there are more MCQs from bacteriology because obviously it is a vast topic. But the trend has reversed nowadays. You have a lot of more MCQs from mycology, virology, and parasitology, which are relatively smaller topics as compared to bacteriology, and they are much more productive. So you need to redirect your energy towards those smaller topics. Now, coming to bacteriology, you'll have questions from bacteriology. But again, going towards revision, if you look at the topic of bacteriology, it's a huge, huge topic. It's totally confusing. It was for us, and it must be for you guys as well. But then I'll tell you what I did for bacteriology, because it is vast. So I took 3 to 4 A4 size paper, and I just classified the entire bacteriology into those 3-4 A4 size paper into cocci, rods, gram positive, gram negative. Then I took my notes and write down only those points which are important or volatile or which are difficult to remember, like staphylococcus, coagulus, positive, negative, or whatever is the appearance, or what are the diseases it causes, PSS, etc. So what happened is now all of a sudden the entire topic of bacteriology I could see with my 2 eyes at one place at one go, and then I would not revise bacteriology separately. Every day whenever I'm having tea or coffee, I'll just sit down in front of that chart paper. I'll sit and I'll just passively revise. Now this is a hack. I'm telling you how not to waste your active time but still passively revise difficult topics. And if you'll keep on revising that chart for many days, you'll see you'll have a pictorial memory kind of thing, right? And second, immunology is important. You'll have good 4 to 5 questions. And but then there is parallel pathology and microbiology both come into immunology. So make sure you give time to immunology. And images are important. And as someone asked, sir, what should I do in the last 4 days? Again, you should collect the images in micro, patho, and other subjects so that you can briefly revise them before the exams.
Sir, images मतलब pathology तो पूरी images ही images है ना sir, उसके लिए क्या करेंगे?
So images, what I feel is you should have a bank of images or bookmark those questions with images which you want to revise before the exam, like which are commonly asked, the images. Like in fact, micro has become 50% the questions have become image based in microbiology.
What about pathology sir? Pathology कैसे करें?
पैथोलॉजी सर देखो, पैथोलॉजी में the MCQs which are being asked nowadays, a huge chunk of MCQs, around 40 to 50%, are from hematology, and they are mostly based upon anemia or leukemia, and there are images, and they are mostly clinical based questions. So those images, sir, what they have to do is they have to frequently revise those images, and they can actually take the help of QBank as well to do those images in the QBank, and if possible, I mean, there are some interviews that I've seen this year of students. They had compiled the screenshot of those images, and so that they can frequently revise before the exam. So you can compile those images for frequent revision before the exams. So one part is that is hematology is asked, and hemat is something which comes in both patho and medicine. So decide where you want to do in patho or medicine, and wherever you're happy, you can go with that. Second is about general path. In general path, cell injury and neoplasia. These are the two aspects where a lot of MCQs are asked. You must go through them. And coming to systemic path, you know, it is widely distributed, and it is something that is repeated in other subjects. So if you are low on time, you don't have much time for systemic path, you can skip, and you can do it in the clinical subjects. And if at all, if it is still bothering you, then you can try to solve only the QBank of systemic path, and try to study a little bit retrospectively, retrospective as much as you can do.
Right.
So that's
जो
also
clinical subject पढ़ा है उसकी pathology we can go and just do the pathology
yeah.
part
So,
of that.
it's all about risk and benefit. It's all about risk and benefit. It depends upon how much time I have. If I don't have much time, then I have to redirect my energy depending upon where the productivity is more. I mean, obviously, if you'll ask me what is 100% perfect, do everything.
Right.
But
right.
but with the limited time we have,
So if we
we
can't
have
do
to.
everything, so if we
Yeah.
can't do everything, hematology though is a must because majority chunk questions will
Yeah.
come from hematology.
Hematology.
General path mein, I think since our time only, sir, cell injury and neoplasia questions will keep coming from those two important
Yeah.
topics.
General path
Whereas
is important.
systemic pathology, we can go to the clinical subject, do that, and do the systemic pathology part of that clinical subject. That way, you will be able to cover most
Yeah,
of the important topics.
they can do that, or they can use the QBank. They can use the QBank to do retrospective study of systemic path. If at all someone is bothered about the systemic path part, they can do that.
I have a point over here regarding what Ranjan sir had beautifully told, that how he completed microbiology. When I was doing MBBS at the same time, we also, everybody struggles with volatile subjects like micropharma and biochemistry. So, beta, I would like to point out over here that when I was doing microbiology, I made all the notes for bacteriology, virology, just in the same manner what Ranjan sir had told. So I studied different books and unke notes banaye, and I put it on single A4 page, and I studied that. Now, my roommate, he was watching me studying microbiology. He asked me, "Yaar, why don't you give me your notes?" So he took my notes and उसने notes के notes बनाए. Unfortunately, उसका एग्जाम नहीं पास हो पाया, मेरा हो पाया, because I studied the main thing and उसका notes बनाया. What I want to say is that when you make notes and you simplify your own material in your own writing, उसका एक benefit होगा, and second student would be who would take that note from his friend ready made चीज उठाया. There is difference between active immunity and passive immunity. ये वही difference है. So make sure you don't fall into the trap के ready made छोटा छोटा notes. If you keep on doing that, then you are missing out on many things. So whatever you have done, now is the time to selectively revise that. उसमें से you need to filter the stuff and you need to put that into A4 page. Make notes yourself. That's what I wanted to say.
Perfect. So can we move on to short subjects now and discuss how to review the short subjects?
Yes,
the
please, let's move
Yeah.
on. Let's move
So
on.
the first short subject I will obviously start talking about is my short subject, orthopedics. I love it. And I'm sure most of you love it, but I don't know if all of you love it. So if you don't love it, and there are a few things that you should remember and make sure that you do while you're revising. Most important ones are the X-rays. Now, orthopedics, radiology, dermatology, these have become image-based question hubs. Most of the image-based questions will come from these subjects. Obviously, pathology as well, but in clinical subjects, these are become the very important topics for image-based question. So orthopedics questions will be X-ray based. So आपको जितनी भी theory आती होगी, whatever you know about the fracture will become redundant and useless unless you are able to diagnose the fracture on the X-ray. So try to invest some time to understand and read the X-ray properly, see which bone is fractured. Many students are confused between radius and ulna, humerus and femur. That is not acceptable. You should know where the fracture is and what the fracture is. And if there are two fracture patterns that are close to each other, you should be able to differentiate them. You should be able to know what is Monteggia, what is Galeazzi, what is Colles fracture, what is supracondylar humerus fracture. This you should know without any shadow of doubt. Okay, so learn how to read X-rays, revise them. We have talked about them in regular videos. We have also talked about them in revision videos. And in fact, in revision videos, I've taught you how to read the X-rays. Second thing is the tumors, the bone tumors. Again, this you must know the theory that is taken. You should know, and it is evidence again. Recently in INI set as well as in the last NEET PG, the questions are based on image, and then the information is tested in theory. So unless you make the diagnosis properly, your knowledge is useless. So you should know how to read the tumor X-rays. The lesion is in epiphysis, metaphysis, or diaphysis. Based on that, make a diagnosis, and then talk about the theory and try to answer the question. That is as far as orthopedics is concerned. Other than that, you know how to revise. It's easy. It's a short subject, and I'll tell you one broad stroke for all the short subjects. If you stick to previous year questions, if you stick to revision videos, if you stick to MCQ discussion videos, and if you know the stuff there, you're done. Because short subjects, they don't usually go beyond expected questions. They will just keep on asking them again and again, because these are specialty subjects. You don't need to know everything in them. In ophthalmology, this is a subject which has a lot of names and difficult terms. You need to make the list of all the named signs, read them, revise them, put it on the wall, and do that. Eyelid pathologies, something that you usually ignore, are tested. Eyelid pathologies, ocular trauma, retinoblastoma, these are the important things. And list out the names of all the investigations done in ophthalmology. That way, in one place, you will have all the names of the investigations to do. Again, all the information that we are sharing with you regarding the specific subject fundas and hacks is our experience, as well as information that we have collected from the faculty who's teaching you on Marrow. So rest assured, these are the things that they also suggest you to. As far as ENT is concerned, Madam is an amazing teacher, and the way she teaches, most of the information while listening to her itself, you memorize, because she was my teacher as well, and it was wonderful. I wouldn't have to worry about revising, but still she's very worried that you should remember these things. You should know how to diagnose the pathology, because the information that will be given on an ENT question will be clinical. So you should be able to diagnose based on the history and examination, particularly the otitis medias, sinusitis, and their complications. That is what Madam has suggested. She's also talked about the hearing rehabilitation devices, all the latest devices and their uses. Pure tone audiograms, that is something that you should not miss. ENT emergencies like epistaxis, tonsillectomy and its hemorrhage and secondary and all that hemorrhages, tracheostomy, neck spaces, and all the endoscopic appearances. Recently, there is a trend of the images of endoscopic appearances being asked. And also don't forget the tumors. Tumors are very important in ENT. As far as dermatology is concerned, Malcolm sir has done an amazing job. His handwriting is amazing, and the way he presents things, very articulate, neatly done. So revise that, whatever you have. But still, these are the things that he has suggested. Clinical images, keep on revising them again and again. Put it in one place so that you can revise them. Infections, particularly STDs and leprosy, try to overlap that with microbiology and pharmacology. That way, reading those drugs will also become easy. Reading the pathways from microbiology will become easy, and understanding the clinical presentation of this condition from dermatology will become easy. So you will have a wholesome picture of that STD and leprosy. Named signs like Kobner, Ospit signs, these are slightly confusing. So put it in one piece of paper and revise it before you go for the exam. Anesthesia, right? BLS, ACLS, muscle relaxants, intravenous anesthesia, and common ICU procedures and things are the things that sir has suggested that you should revise. Radiology, again, heavily image-based MCQs will be asked. The most important area in radiology, sir, is suggested is chest X-rays. Most of the image-based questions will come from chest X-ray. So revise basic chest X-ray related questions, he has said. And the quickest way to do that is through the radiology MCQ discussion video. Sir has said that he has discussed that in detail. Okay, so almost 1 or 2 questions will come from chest X-rays in radiology. That second thing he has suggested is the CT and MRI. These are the next best kind of questions that will be asked. Mostly chest X-ray hoga, फिर CT or MRI hoga, particularly the CNS conditions that you should revise for CT and MRI. GIT and GUT, conventional studies like barium swallow, anema, IVU, RGU, MCU, these things you can brush up, but chest X-ray is very, very important. One rare or remote question that sometimes pops up on your exam, he said, is from the nuclear medicine. So whatever is given in the revision videos, that is something that you can revise and go for the exam. So these are the few things that I wanted you to remember about radiology. Now, as far as psychiatry and forensic medicine is concerned, psychiatry, sir has said to review all the tables that are given in the psychiatry and also the pearls. That will be more than enough. And the certain drugs in psychiatry, again, overlap them with pharmacology. Same thing you can do for anesthesia. The drugs in anesthesia, you can overlap with pharmacology. Last but not least, forensic medicine. Forensic medicine recently has found an increased trend of number of MCQs that have showed up on your exam, 8, 10, 12, in fact more sometimes. So this is something that you should keep in mind. Particularly, sir has just suggested for you to revise your IPCs, CRPCs, IAs, and mechanical and thermal injuries, and how to identify those injuries based on images. Important poisons in toxicology, not all of them, but only the important ones, and their antidotes also is something that you should do. And some important definitions which are frequently asked related to impotence, sterility, and abortion. Those are the things that you should keep in mind. But the safest thing for short subjects is revision and MCQ discussion videos, because short subjects are like those subjects कि आप जितना भी पढ़ लो ना, question उतने में से आना है. They will never go beyond. They might go beyond in pharmacology. They might go beyond in medicine, pathology, community medicine. But short subjects, they will stick to the fundamentals because they know these are speciality-driven subjects. What do you think, sir?
Yeah, absolutely correct. So for short subjects, I think beautifully sir has explained almost everything, focusing on all the important high yield points.
Yeah. So short subjects has been actually, even in our times, it was a kind of thing that was understood that you have to score really well in the short subjects. The reason being, the MCQs, they go like this, they don't go like this. So the way they ask MCQs, there is usually a set pattern which they don't deviate much, except sometimes in ophtha and ortho, they have bounces, but skin anesthesia, radiopsychiatry usually is highly scoring. And during revision, even I would like to emphasize, if you are a kind of person who tends to get depressed if things are not falling on track, then don't begin your revision with a subject like medicine, surgery, or gynae. Begin your revision rather with a short subject. Because see, that is the kind of solace we need to give ourselves, serotonin. We need to give ourselves that, okay, I'm done with one subject. So start with skin anesthesia, radiopsychiatry, something like that.
When we used to prepare for post graduation, I think you also would be remembering, sir, कि उस time एक किताब आती थी वो SARP करके, SARP. That went like bingo. SARP was, then they started with short subjects and then they went into medicine and surgery and bigger subjects also. But that name, it's a brand name now, SARP.
I mean, you see, sir, the trend. I mean, the last 3 years, all the tumor questions that they have asked in INI set or NEET PG have only been either giant cell tumor or sometimes osteosarcoma. Most of them are giant cell tumor. So they do not go beyond the scope of the subject because उनको पता है ना कि बच्चे को इतना ही आता है. This is what they have been taught. So there is no point. Sometimes, like Ranjan sir has said, bouncers will come, but don't worry about the bouncers. So if you want,
from MBBS student, what else we want? Like it's say ज़्यादा तो it's not required at this level. Yeah, specialization करेंगे तो they'll do it at that.
Absolutely not. It's my subject, and I will not lie and sit down and say कि पढ़ लो बहुत important है, पूरे marks उसमें से आएंगे. ऐसे नहीं होगा, right? It's a short subject. So just focus on the previous year questions, revision videos, and MCQ discussion. You should be set, right? But if you have done more work, you should be very happy. But अगर नहीं किया तो कोई बात नहीं. Right now, sir, this is an open debate now that I want to discuss with both of you. A lot of students have been asking कि अगर if I have not done anything, is doing the revision videos enough, or is the MCQ discussion videos enough? So I want to take a few moments here and debate the pros and cons of revision videos and MCQ discussion videos based on your personal opinions.
Yeah, let Ranjan sir give his expert opinion right now.
Yeah, see, for me, revision videos, they are an excellent tool. It's an excellent tool, revision videos. But the problem is, it's a tool that is not going to fit into each and every nut and bolt. You know, I mean, you have to recalibrate it and use it depending upon your own need. Now, suppose there is someone and who has done a couple of who are late bloomers, started late in the preparation, and there is not much time to do the main videos. You can just do quickly the revision videos with the notes, and be bowlers on the QBank, solve a lot of questions in QBank and GT, and you can use it that way. Otherwise, those who have not yet started preparing, not had done anything, they can use revision videos with QBank and GTs, and they still have a good chance of getting a good rank or under 10,000, like 5,000, 6,000. You can easily get it. The only thing is you have to be very serious about it. So yes, a revision video is a very good tool. But then coming to another part, suppose there is another student who has done main videos, is very confident in the notes, then should he do revision videos? I feel no, you need not. I mean, rather than using the time for watching those revision videos, I would rather invest it in revising and re-revising my notes of main videos. So the use has to be specific for a specific person.
So if you have done, जैसा आप बोल रहे हो ना sir, if you have done the regular videos, if you have prepared your notes, better revise the notes rather than wasting your
Yeah,
time.
I mean, there is no fun. There is no fun because it's the same me teaching pharma in revision videos, right? So and what is a revision video? It is a more concise version. Now, one more thing is, one can use revision videos in as a kind of filler. Like, for example, you have 10 hours of target a day, there 8 hours have gone by, and now you're in no mood to do any active study, right? I mean, but you still want to study, but so you can just switch on, put on the leads, and just relax and passively watch the videos. You can do that. I mean, as a user, is a filler. Sometimes you can do that.
Yeah, similarly for MCQ videos also, the test and discussion, MCQ discussion videos, they can be used as a filler. For example, you are doing two subjects at a time, or even if you're doing a single subject, you have revised maybe general pharmacology today or in last day, and you have done community medicine. So in the evening, when you get 30 minutes or 1 hour, you can easily watch two videos, test and discussion, two videos you can watch in 30, 40 minutes or 1 hour, right? So you just watch that test and discussion video, that will give you the knack of solving the MCQ and listening to the explanations as well. So use MCQ discussions as filler, and revision videos, you should be using them selectively. Many students, at least in community medicine subject, they have completed their whole main videos. They have completed community medicine from the main videos. Now students ask me like, should we do the revision videos? Yes or no? It's not at all required. You have done the whole syllabus from the main video, stick to that. But yes, for updates, you do get updates, you do that from pearls. You don't need to waste your time on revision videos. So yeah, use them selectively.
So I mean, if I can summarize what both the sirs have wonderfully put, is that if you have done the regular videos, if you have made your notes, why waste your time? But there are certain subjects where the faculties themselves have suggested to watch certain revision videos which has updates. You go and watch that and move on. Now, if you're like Ranjan sir has said, if you're feeling lonely, if you're feeling bored, if you're exhausted, you want to passively learn, it's easy to listen to your teacher teaching. And I am one of those people who feel that listening to someone teaching you is something that will stick with me longer. So if you are that kind of a person, it will work for you. But as far as short subjects are concerned, if you're worried to revise, if you're worried that your notes are enormous, then sticking to the short revision videos and MCQ discussions will give you that concise scope of revision. Because short subjects, yes, it will not go beyond that, and you'll be actually doing yourself a favor if you stick to the revision and MCQ discussion videos. Right. Now, the next thing that I want to discuss here is a lot of students are talking about a question bank and revising the complete question bank. Some students have said, sir, ki they have 7,000 bookmarked MCQs.
Yeah.
How should they go about revising the question bank? Should they do the whole question bank again? Can you just give us some pointers how to go ahead with the question bank revision?
So question bank revision, I would suggest that do only the bookmark questions which you have done them wrong, and you try to remove the bookmarks. Try to decrease the number of bookmarks. If the question is coming again and again in the QBank, specifically talking about all the major bigger subjects, if that question is coming again and again, that definitely means that that question is important, and the explanation of that question you should be knowing by heart. So just two words from my side, that QBank should be done at every cost. See, if you are going to play match in Eden Gardens, cricket match, and you can't practice a gully cricket with me, you have to go to Eden Gardens to play that match. That means that you're going to give a MCQ exam. So to give the MCQ exam, you should give the MCQs. Don't read theory all the time. It's not done. You do the theory and then you do the MCQs, because in your exam nobody will ask you to write the long question or the short question. You have to answer MCQ. To solve the MCQ, you should do the MCQs. So QBank is a very good way, but do it with caution. Like bookmarks ko reduce the number of bookmarks, and if the question is getting repeated, you need to know that question in and out. That's the whole nutshell.
Ranjan sir?
Yeah, so I'll touch upon something else with related to QBank. Like if some of them they have been asking how many questions should I be doing, and I'm not able to do the whole QBank. Then I mean, what should I do? If I'm not able to do the whole QBank, it does not mean you will not do anything. And it's not about how much you have to do every day. It's about how much time you have. So whatever time you have, divide that between revision into your notes, videos, and QBank, and do as much as you can, right? Try to remove as much bookmarks as possible. Now, remember one thing: nobody's preparation is perfect. When you go to the day of exam, you'll always have a feeling I could have done this or that, right? It will be there. It happens with everybody. So you need not worry if you're not able to do everything, but try to do as much as you can. That's also I'd like to say in this aspect.
Sir, what about subject-wise tests? Now, there are subject-wise tests where MCQs are there from one subject, say 100, 150, 200 questions. What is your opinion about that? Because some of the students have been asking, should they do that or should they stick to the question bank?
So subject-wise tests, I feel, I mean, they're more important when you complete a subject and then give the test, and then again complete a subject, give the test. They're more important that way. But now, see, again, sir, the problem is with time. I mean, you should do everything. But now with the limitation of time, you have to see that in this limited time, what can you do? Now, subject-wise tests, you can use it selectively. Suppose as we will go into that, like how to improve the GT score. We'll talk about that in a short while.
Okay.
And that is where subject-wise test might be handy if someone is not performing well in the GTs because of 2 or 3 subjects, which are the weak links for that particular person. So he can go for the subject-wise test in those to even find out where is he that more weaker in those subjects. Like for example, in anesthesia, is he more weaker in the drugs part or the non-drugs part of anesthesia? So whatever it may be, that is how they can use it if they want it.
Okay, so if I can just summarize what both of you have wonderfully put in terms of revision with question bank, the first thing that Mukhmohit sir has said is to focus on the bookmark questions because these are the ones that you have intentionally marked at the time of reading because you have either not understood it completely or you have made a mistake there. So go through that, and once you go through it and you realize, yaar, I know this, ye to pakka ho gaya na, so you remove the bookmarks. That way, we want you to minimize the number of bookmark questions. So when you go through the first revision, you are in fact able to half it. So if you have 10,000 bookmarks, you can make it 5,000. If you had 5,000, you can make it 2,500. So reduce the bookmarks numbers as much as possible. Be aggressive with it. Thoda bhi agar aata hai to wo bookmark nikal do. It means it's there in your head. That will help you in your second revision because in your second revision, you're revising the questions that are more volatile and something that is very tricky. Another thing I would like to emphasize is not all the tough questions are important for you to grasp because if there is a question and you see that the percentile of students answering it is very less, it means that everybody doesn't know it and you also do not know it. And look at the hashtag. If it has not been asked before, it's not a repeat question, then you can just let it go because utna effort laga ke usko seekhne mein you will be wasting a lot of time. And very important thing Ranjan sir has said is that the most valuable asset right now is time. You can sit down and plan to do everything. You can read the standard textbook, do the question bank, watch the regular videos, revision videos, previous year questions, sab kar lo. You can become a PhD in one particular subject. But that is not the aim. The aim is to quickly skim through the subjects so that you will be able to answer MCQs on the exam. Exam में आपका MCQ correct होना चाहिए. वो कैसे होता है, nobody will ask you. So that way you have to be a little ruthless and little forgiving to yourself. FOMO में नहीं जाना है, नहीं हुआ तो कोई बात नहीं. Move on to the next thing.
Yes.
Sir, let's talk about grant tests now, because I think this is
Yeah.
high time students should focus and give grant tests. I want both of your honest opinions about grant test. What is the minimum number they should give, and how to go about reviewing them? And once we talk about that, we will talk about how to improve the GT score.
Yeah.
So,
So
okay,
yeah.
go ahead.
So GTs, see, it again, it depends from person to person how many GTs you should be giving. Now, I'd say like you should giving at least one GT in a month going forward, and maximum it should be two GTs in a month, right? If and it entirely depends upon what kind of person you are. I mean, how good you are at theory. If you're too damn good at theory and you're feeling like bored with revising the same stuff, please go ahead and give four GTs in a month. But for most of the students who are average students like us, like me, we would like to
सर आज चलेगा
As
यहाँ पे कोई फर्स्ट रैंकर नहीं है
focus on one or two GTs in a month. And while you give those GTs, reviewing a GT is also important. Like I'll tell you how I used to review GT. I used to give myself 4 hours to review GT because I didn't have time, because I had to use my time to revise my notes. So I would just give myself 4 hours, and I would begin reviewing a GT. First of all, to begin with the questions that I've done wrong, right? And I'll review them. And after that, if I have time, I'll go for some others. But frankly speaking, I never had time. I could barely, scratch to review only those which I did wrong. So that should be your first priority. Then you can go for others if you're able to do that. So reviewing a GT, because as I said, time is limited now. So you have to give yourself a limited amount of time to review GT, and do as much as you can, and then forget about it. Don't feel guilty and move on.
yeah,
Mukhmohit sir, how many GT? Sir has said two in a month, every 2 weeks is enough, something that is practical. तो आपकी क्या opinion है?
मेरा
How
थोड़ा सा
many?
मतलब I had been even when I was preparing, I had been more of a MCQ retro type of person. So I used to study a lot of retrogradely, like many subjects I did using retrograde manner only. So for grant test, I would suggest, like, of course, two is one of the. I would say that two is a basic minimum number and ideal number also. But if you can reach more than two, that I would definitely advise that you can reach more than two. It's important to give all the grant tests in an exam scenario. That is one of the most important thing. If you're just opening the grant test and you're reading all the questions and you're doing reviewing the grant test just after that, that's not done. You have to give the grant test in a very timed manner, and you should be doing it in full exam scenario. That is one very important thing. Next is, if you are getting about the GT scores, like I don't know, what do you think is the average GT scores? Any idea on that? Like, how about the
Sir,
GT scores?
I would personally say absolute scores do not matter much, because every student is different in their journey of preparation.
Yeah,
Someone has finished 5 subjects, someone has finished 10, someone has finished 19 subjects. So everyone is at a different stage of preparation. So absolute scores, in my mind, do not hold much value. What I personally feel is that you should see whether your score is improving or not. If you're not improving, then you're doing something wrong. Your aim has to be to improve your score by at least 5% every grant test. Hopefully by the time you come to the exam, it should be much better than what you started with.
yeah, that's what. Matlab, what you are saying is exactly what we do in a very rural healthcare setup, sir. IMNCI, that is, they plot the growth charts. In growth chart, the point of the weight and age of the child does not matter. What matters, the location. Even if the child is in red zone, yellow zone, it does not matter. Even if the child is in red zone today, next month he is more into the red zone but above than the previous one, it is taken as a good growth. So that's what you imply, that same thing on your GT scores, that the point of location of your score does not matter. What matters is where you are from the previous GT. That is done. But my point is, if in case a student is scoring some GT scores which are less than 100, score ही 80-90 में घूम रहा है, less than 100 score, I personally say that you are lacking. I personally, that's my absolute personal thing. I would say that the student is lacking somewhere in the major subjects. Subject mein, theory mein, they need to work on. But in case if the student is scoring around 130-ish, 120-ish, I'm not exaggerating or decreasing. So if the student is scoring around 130 ke aspas, 140 ke aspas, I would suggest that now I would say that the theory is pakka. You solve more grant tests, you solve more subject-wise tests. Now you put effort into QBanks. So now your target should be 90% of your time you should be putting into MCQs. But in case your scores is way below 100, then you need to focus more on the revision videos. You focus more on theoretical part. But if your rank is like, if your scores are 140, 150, 130, you're hanging around that area and you want to improve 130 ke upar improve karna hai, then your theory is theek hai, but you need to work on MCQs. That's what I personally would say.
Right. So this is what I would like to summarize and re-emphasize what Mukhmohit sir has said. Is that, see, first of all, your absolute score does not matter. But if your absolute score is zero, like someone who has said here, sir, my INI set mock exam, I got a zero score, then it means that you have done something definitely wrong. Because you see, the more subjects you start finishing, you start covering, you start completing, your score should automatically improve, because those are the kind of questions that are asked. If you finish your medicine, surgery, obs-and-gyn, pediatrics, and short subjects, then you should definitely score more than 50 to 60% of the paper. You should, because those are the subjects that you have finished. If you are unable to do it, the problem is that you have not understood most of it. You have just finished it. You have just read it without understanding. And if you have read it and understood it still, you have not applied it in a question scenario. So you must do the question bank. So either way, you should know what your weakness is. Your weakness can either be theory, which is the lack of information, or lack of question practice, which is the lack of application. If you have the theory and the application put together, then you should definitely score. If you're unable to score, it means that you either do not understand the language of English or you have done something drastically wrong, which I don't think will happen. If you do the subjects and practice the questions, your GT score will improve. Now, the problem of G2 scores not improving are of two folds. One is that you're already at a very high score level. You're already at 160, 170, and you want to go to 180, 190. Then you will have to worry about, focusing on those rare redundant things that are rarely or remotely asked on your exam. And I don't think those are the people who are worried about revision. The people who are unable to score more than 80, 90, 100, these are the ones who think that their GT score is not improving. So if your GT score is not improving and you're at the bottom of the segment around 80, 90, 70, so this is what you should do. After every GT, you go to the GT analysis and look at the bottom 2 or 3 subjects. What are these bottom 2 or 3 subjects? Have you read it? If you have read it, revise it. If you have not read it, read it. Because unless you improve your bottom subjects, your scores will not improve, na bhaiya. So if you have 19 subjects to read and you are going to the exam with only 8 subjects, you will be unable to score more marks because you only have knowledge of 8 subjects. So increase your knowledge by doing the bottom subjects.
Now, over here, exact at this point, sorry to interrupt, Abbas sir, and exactly at this point comes the role of what Ranjan sir had told A4 wala paper. If you had made that A4 wala paper, in case you had made that summary, you go and read that. नहीं है तो you ask some of your friends, search Google, search internet, कहीं से marrow के pearls उठाओ, take साम दाम दंड भेद. The point should be you should get your question right. ठीक है? You know the theory, you don't know the theory, you know the explanation. यहाँ पे all the points जहाँ पे you marked the question wrongly और या weaker areas, उनको कहाँ से पढ़ना है? You take the summarized notes now. यहाँ पे आता है revision videos के notes का function. So that's what is more important, that if you're lacking in QBank, you revise QBank, and that's what sir had told about subject-wise test. If you're lacking in theory, now you go towards notes and revision notes and all those things.
So that's what Ranjan sir has said now. So if your bottom 2 subject, may suppose your weak subject is psychiatry, go and do the subject-wise test of psychiatry.
Yes.
Do the revision videos of psychiatry. Do the MCQ discussion videos of psychiatry. That way, your psychiatry will become stronger. And next GT may your psychiatry score will improve, and then your overall score will also improve.
Yes, वो कहते हैं, I'm sorry to mix a little bit of Hindi if I'm just allowed. जब हौसला बना लिया ऊंची उड़ान का, फिर क्या देखना कद आसमान का. So if you have just made that, yes, I am going to do it, then just go ahead and strike it. Whatever it takes. Sam, dam, dandaved, you take revision notes, you take this notes, you take that note, you have to get the question right.
Absolutely. So I think, sir, we have covered everything about how many GTs to do, how to improve the score. We have also talked about how to review the GT.
Yeah.
Right. So can we move on to the final small revision, the last revision that they can do after the 45 days and 15 days first and second revision?
Ranjan sir is expert in this.
Yes.
Yeah. See, basically, if you talk about that last 15 days and that micro revision, and see what would I like to do in those last 15 days is whatever I have revised in the 45 days, I have to revise it in 15 days. Now, try to understand this. If you have not revised it well in 45 days, you will not be able to revise it in 15 days. You will not. So how productive your 15 days revision would be, it would depend upon how well you have revised in the first 45 days. If you revised well, you'll be able to briefly cruise through those 15 days. Now, why is this 15 days revision important? Why would not I revise one revision in 60 days? Rather, I would break it down into 45 and 15 days. The reason being there is something called as recent memory. So because of recent memory, you'll not do a lot of mistakes, right? So whatever you have done, whatever you have revised in 45 days, as a person, what I would do, I would replicate the exact same thing in 45 days that I've done into 15 days, but faster, quicker, with speed, right? And at last, if I come to the 4 days, 4 days before the exam, in the March, 1st of March till 4th of March, those 4 days, I would revise, I would do some things differently so that I'll get at least 4 to 5 questions extra by minimizing silly mistakes. How can I do that? I'll revise only those stuffs which are important. Like, for example, in pharma, I'll briefly overlook DOC, 4 to 5 pages of drug of choice, and I'll briefly overlook those 20-25 drugs. So I can do this easily in 1 to 2 hours. 2 hours I'll take, or 3 hours max. Similarly, in pathology, in microbiology, I'll look briefly the images which are important, right? And so similarly, the 20th notebook, which a lot of people talk about, is you can use the 20th notebook only to revise in those last 4 days. So the idea is like this. This is the content you have. Do a 45 days revision, then a 15 days revision, then do a 4 days quick brush up, and then go into the exam. So we are squeezing the information gradually. Yes, sir.
Sir,
So
Mukhmohit sir, do you want to add something?
Yeah, but I think sir has beautifully covered all the points in the smallest revision module. Nothing much to say. Whatever you have done, sir. Many students are asking कि ये how to revise faster. अब ये faster वाला क्या फंडा है sir? How to read faster? ये read
sir, faster revise करने का, if you want to revise faster revise. What do you mean by revising faster? It
Yeah.
means that you have a target and you want to cover that up in that particular time period. And for that, I mean, I'll tell you what I used to do. I used to divide the day into different topics. And suppose I have to revise cardio and respi, then I'll divide that. Then I'll give 1 hour for arrhythmia, 1 hour for heart failure. I'm just saying hypothetically. So I know that I have 1 hour for arrhythmia. So I'll try to revise as much as possible. And if I get a message, if someone is on the door, I'll just knock them off that I don't have time. Why? Because I know I have this only 1 hour for arrhythmia. So that kept me on the toes, that this is the time I have, and if this time is gone, then I don't have another half an hour to revise arrhythmia. So you have to have hourly goals. And suppose sometimes I would study, and after 1 hour, some portion is left, then I would just leave them and be at peace. You cannot do everything possible, and that's okay.
ये सबसे बड़ी मुसीबत तो I think this is the biggest distraction. If you want to read fast, इसको you keep it aside. The mobile phones, that devices that we have, even if it is kept like on the silent mode, and even if the phone is kept near to me, subconsciously I always get the you can say I get the obsession and compulsion to just pick up the phone after 20-30 minutes. यार let us see insta पे कोई post आया कि नहीं आया, या telegram पे कुछ हुआ कि नहीं हुआ. You get that compulsion within you. So one thing beta I would seriously say is that when you are, दो चीजें हैं. Of course this should have been my closing remarks, but there are two things. One is you should have that felt need. जब तक वो अंदर से you don't get that felt need that this is what I am supposed to do, वो when you focus it, till that time we don't achieve anything. And once you get the focus, you have to leave aside all the distractions. Distractions are the main root cause of your delay in revision. That's what is I wanted to come over to. That you leave aside all the distractions, automatically you will see that your speed of revising and your speed of studying and the amount of data that you integrate, imbibe, and you put into your gray matter, that is going to increase.
I think what Mukhmohit sir has said perfectly is that you should have that need. अगर आपको भूख नहीं लगी तो आप खाना कहाँ खाओगे, right? Unless you have the need, unless you have that want, that desire, that burning आग जो बोलते हैं ना, to crack the exam, nobody can force you to sit down. And I think, sir, मैं तो मेरा personally, I'll tell you, it's been so many years since I have written or appeared for any exam in my life now. But still, right now, if I want to pay attention to something, to focus, to do something, like for example, we've been planning to discuss this revision session with students now. So I would keep my phones outside of my study and come into the room and focus on the work, because I do not want any kind of distraction. I want to focus on the job or the objective at hand. And once I'm done with it, and only when I'm done with it, I go out and check my phone. Because phone, whether you like it or not, is a huge distraction even for people like us. तो आप लोग तो बच्चे हो, आप तो distract होंगे ही. So please understand.
Same for me. I also always keep my phone outside, and absolutely, this is one of the biggest decrease in the pace because of the phone.
Right.
एक और चीज है सर, इतना बड़ा सूरज है सर, सूरज, sun, इतना बड़ा है. Even if I put this small, I don't know if you can see this small sheet of paper, बाहर रख दूंगा ना. I'm sorry for including Hindi over here, but if I put paper को, कागज को भी बाहर रख दूंगा, सूरज इसको जला नहीं सकता. सूरज को, इसको, कागज को जलाने के लिए भी फोकस होना पड़ेगा, लेंस के थ्रू जाना पड़ेगा. इतना बड़ा सूरज कागज नहीं जला सकता until and unless it goes through that lens. जब तक फोकस नहीं होते, till the time you don't focus, till the time you don't get that felt fire inside you, वो जुनून नहीं आएगा, तब तक you would not be able to increase the speed in revision. यहाँ से मतलब the whole story started from that increasing speed. क्या increase speed? मतलब how can you read a page faster? You can't read a page faster, but yes, distractions हटाओ, focus बढ़ाओ, that's all.
Sir, Ranjan sir, एक specific question आपके लिए. Students are asking how to improve memory capacity. कोई माजून या दवा बोल दो सर.
ये तो मेरे साथ पूछो, रंजन सर ने मेरा इम्प्रूव किया कैपेसिटी.
बताओ मुझे सर, क्या बताओ.
बादाम खाना है.
बाद में बताऊंगा.
देखो सर, see, there is no drug as such. There is no drug as such for memory. I remember once there was a drug called as Mega Mind, released by a drug company, saying that it would improve your memory, attention span, intelligence, etc. And this is all is nonsense. There is no drug, there is no pill for that. And in fact, some students, they ask me, sir, I feel sleepy, so can I take amphetamine or modafinil? Now, you might not clear the exam, but you'll become a drug addict after, you know.
Yeah.
So I mean, there is coffee, or there is something else you have to do, or, you know, but there is no drug as such. There is no drug as such. A drug, see, why you might be eager so much to take a drug, but you'll come to a life after 40, 45, 50, and when you'd actually need a drug, right, for a disease, then you'd be worried that I have to take a drug. So without drug, life is so good. So you don't have to take that.
Yeah.
Right. Wonderful.
There
I
is no
think
drug
that
as
has summarized the बहुत important चीज यहाँ पे Mukhmohit sir has said. To increase the speed, there is no such thing as increasing the speed. You increase your focus, you will increase your speed. And what Ranjan sir has said, there is no shortcut, there is no drug. You increase your focus, you will remember things. And you see, we are human beings, we are born to forget things. So the only way we can improve that is by revising. So that is what sir has nicely put now. Read, revise, and re-revise. So do that. Okay, a few things that I want you to make sure that you do not forget and miss out, because this was a long session. We have discussed so many things, but these are a few fundamentals that you should not forget. Revision is essentially reviewing the things that you've already read. So if you have read something, you will be able to revise that in 45 days, like Ranjan sir said, and then you will be able to revise it faster in 15 days. If you have not read it, you will be unable to revise. So पहले ये समझ जाओ. You will revise only the things that you have read, and please do not do something new. There is no point in joining or attending any new short revision course. You know, those are all just marketing gimmicks. Nothing will work for you. Previous year questions. This is the keystone of your preparation, particularly for your NEET PG exam. So do the previous year questions from NEET PG, INI set, if you can get access to FMG questions, and also UPSC CMS questions, because a lot of overlap information is asked. So you never know, direct repeats can come, repeats with most common wala, similar options may come. So that will be handy. And even if you're unable to know the exact answer, there will be this feeling of satisfaction that you know about this, and when it shows up on the exam, you will be able to think about it and come to an answer, because you're familiar with the question, because familiarity wali feeling aa jati hai if you know a question that has you have read somewhere and it shows up on your exam. And fortunately for you, all the faculties have put in the hard work and made all the recall videos of at least all the 3-year questions. Sab available hai YouTube pe. You can go and watch them. So instead of wasting your time looking for motivation videos and you doing random things on YouTube or scrolling the reels, watch these recall videos. It will help in answering the MCQs as well as giving you the information. Now, I would like to ask both of you for any closing words that you have, so that we can wrap this session up. Let's start with Mukhmohit sir.
Closing words, right? I was not prepared for this. But anyways, closing words, remarks would be again sticking to that same old funda beta. You have to be focused and अपने आप को इतना मतलब अगेन एक हिंदी में मैं बात कहूँगा, जीतूंगा मैं, ये खुद से वादा करो. You have to be determined that yes, you are going to win it. जितना सोचता हूँ उससे ज्यादा मैं मेहनत करूंगा. तकदीर भी रूठे पर हिम्मत ना टूटे, मजबूत इतना इरादा करो that we are going to win this game. So that's what is the felt need. Till the time you don't get that felt need, many students, I'm seeing the chat box that you have left your job. Beta, you have left your job for clearing the NEET exam. That is a biggest motivation. If your parents are watching you to become a specialist very soon, your families, your friends are watching you to become the specialist very soon, make sure that you are accountable to everyone. So put in your best efforts. I personally say that anybody else's strategy may not be the best suiting to you, but you have to fight your own war. So we can just tell you that martial arts mein hota hai that we can tell you कि kick ऐसे जानी है, but in the real fight you have to do the kick yourself. So get that felt need, get that motivation yourself. Your self motivation is the best thing which will work for you. Stay focused, and that's the only thing which is going to help you. So thank you so much.
So I would personally say, I mean, this is what I believe in, and it has worked for me. You have to start believing. You have to start imagining ki life kaisi hogi rank aane ke baad, after you crack the exam. You have to start imagining that, and once you start imagining that, you will feel so good about it, and that will give you the motivation to work hard, struggle, slog, stay up in the night. See, we are all human beings. We get tired, we get exhausted, we are lethargic sometimes. We want to watch the World Cup final, we want to do so many things, we are distracted, we want to hang out with friends, but we have to stop us ourselves from doing that, only because we know that the end point of is something great, something big that we are going to achieve. So what is that? You have to know that. You have to know that you are going to be a doctor, you are going to be a specialist, which a lot of people will look up to. Your parents will be so proud of you. You will get amazing marriage proposals, you will have a wonderful time, you will become rich. So there are so many good things that will come out of all the hard work that you're going to put in now. So the sacrifices that you will make now will definitely upgrade your life, will make your life better. I'm not going to say that it's going to be end of the struggles and then you will have a pristine life, but it will definitely be an upgrade. So wouldn't you want to upgrade your life to the next level? Don't you want to buy that fancy car? Don't you want to do things better than what you're capable of doing now? So I think that itself is a huge motivation to push you to do the difficult things, because this time right now is probably the most difficult phase of your life, and unless you have something to look forward to, it will feel like a drag. So keep something as an ambition and work towards it, and you will find your success. Don't worry about the rank, worry about improving yourself, because no one knows what will happen on the day of the exam. We have seen many good students succumb to the exam and then not even qualify, and we have seen average students find their success because they just got lucky. Anything can happen and things can work in your favor. I wish you all the best, and I would like Ranjan sir to give his closing thoughts and end the session.
One point, all the students who are watching this, do you think that Abbas sir, Ranjan sir, me, or any other faculty, they have not struggled. You might be seeing us in a different stage right now. But I think Ranjan sir, you must be remembering all Gautam Nagar ke days. Abbas sir, you must be remembering your PG entrance ke days. So
Yes, sir.
we all have struggled. Train mein jaake, pedal jaake, we have taken classes, and everybody has struggled. Everybody has gone through this stage, and you are also going through this stage. There's not anything which is new. So you have to just keep on your momentum. Yeah.
Yes.
Sirji, your turn,
So,
please.
so can we have the last slide, in fact?
Yes, sir.
All right, guys. So you can see the bird, and the bird is phoenix. So this last few words for those students who are currently buried under their ashes of failure. So for you guys who have not done well in last NEET PG or the current INI set, for you guys, be a phoenix and rise from the ashes of your failure to fly into the sky of success above all who have written you off. So whoever has doubt in you right until now, prove them wrong and work day in and out, right, to make yourself capable of getting that rank. And finally, I'd like to say one more thing is like this football season is going on, and so there is one thing you might wonder that we have great players like Ronaldo or Messi, and even these guys they miss penalties, right? So many people think that scoring a penalty is very easy. No, you have seen a lot of people they miss penalty, and why they miss penalty? Are they not good footballers? What is that change during that particular time when a footballer takes a penalty in a match? Have you seen the amount of crowd, the noise, the pressure, millions of people watching you? That pressure is what makes them miss the penalty. They're the same good player, right? That kind of pressure you are under on the day of exam, right? And you have to learn how to handle that pressure on the day of exam so that you can score the penalties one after another. But you'll miss some penalties, means you'll do some questions wrong, and it is okay. No matter how much you study, you'll have some silly mistakes, and you have to bear those. But one thing I have realized in my life, any preparation, if it is honest, at the end of the day, it yields at least something. If not MDMS, then diploma. If not diploma, then DNB. If not DNB, then I don't know. But anyways, it yields at least something. So guys, this was just a session from us, and it is not binding session. It's not binding. You don't have to follow our each and every word. Remember, the best person to make a timetable is you yourself. The best person who knows yourself is you yourself, and you are the best person to design how to revise. We have just given our inputs. You can take them or miss them, and just make a timetable for yourself, right? And you have to walk in this last mile, and we can only guide you. We can show you the way, but remember, there will be moments of ups and downs. There will be moments when you'll feel like crying, and at that time, you just remember, why are you doing this, right? All of us, we have different kinds of motivation. So let that motivate you for whom we are doing it, for whatever purpose we are doing it. And God bless you all. Lots of love and blessings from all of us. Take care, guys.
Thank you, and
Thank
have a
you.
good night. We'll see you on the other side. Bye bye.
Thank you so much. Bye bye.